Hey everyone, Dr. Todd from Gonstead Spine & Wellness. I'm standing here with Kaitlyn. We're about to take her through a digital motion x-ray study to see if there's any spinal ligament damage or abnormal movements in her neck. We are going to take you through the process. I'm going to explain what I'm doing, when I'm doing it, and then I'm going to bring you right around to the computer screen and we'll be able to play back the video, and I'll point out if we find anything exactly what that looks like, and then we can talk about what that means and what can possibly be done to address those findings. Now we're going to go to a split screen so we can see you simultaneously while you move and your image on the screen of your spine. All right. So what we're going to do before we go through any of the movements, I'm going to demonstrate it for you first, okay? So first one, what we're looking at is we're going to do a nodding view, almost like this. All right, and come back to neutral. And what we're doing is assessing for the ligaments in between the skull atlas, which is C1, so the first bone, and the second bone. So we're looking at how all those things move. They move too much, too little. Okay. So it's just an upper neck, kind of like you're jutting your chin forward a little bit and coming back to neutral. Okay, so we're gonna go ahead and get started here.
DMX, continue recording.
Okay, go ahead and jut forward. Good, back to neutral. Do it again as hard as you can, jut forward, really push it, back to neutral. Okay.
DMX recording, pause.
All right, on to the next one. We got a good picture there. This next one is a bending x-ray of the entire neck.
DMX, continue recording.
Okay, go ahead, look down as far as you can. Okay, all the way back up as far as you can. Good, back down as far as you can. Back up as far as you can, and back to neutral.
DMX recording, pause.
All right, got a good image there too.
DMX, continue recording.
Okay, lean your body back a little bit. Good, go ahead and bend down as far as you can. Okay, bend your head back as far as you can. Good, bend down as far as you can. Lean your body back a little bit. Okay, bend your head back as far as you can, and back to neutral.
DMX recording, pause.
Yeah, that wasn't too bad.
Okay.
All right, I'm gonna have you come this other way, meaning we got a good image. Now you're gonna go 45 this way.
Oh.
Yeah, better. Lean your body forward. Good, bend your head down as far as you can. Okay, bend it back as far as you can. Okay, down as far as you can. And back to neutral. You're definitely tipping your head there, but I'm still seeing it, so.
DMX recording.
It's okay. This is a hard one. I can see all the information I need, so we're okay. I'm gonna have you face forward. Now this one is gonna assess how your head goes back and forth.
DMX, continue recording.
Okay, lift your chin up a little bit. Good, bend your head to the right as far as you can. Okay, back to the left as far as you can. Okay, to the right as far as you can. Lift your chin up a little more. Other way as far as you can. And back to neutral.
DMX recording, pause.
And you're going to open as wide as you can with your mouth. When you open, it makes a window so we can actually see the upper vertebra. Because instead, if you don't, your teeth and your jaw get in the way.
Okay.
All right, you ready to roll?
Yep. DMX, continue recording.
Okay, open real wide. Turn to the right as far as you can. Okay, turn to the left as far as you can. Back to the right as far as you can. Back to the left as far as you can. And back to neutral. Okay, close your mouth.
DMX recording, pause.
Okay, great. We're on the last one now.
Okay.
Okay, so start with your mouth closed.
DMX, continue recording.
Okay, go ahead and open the mouth. Good. Bend your head to the right as far as you can. Nose back to midline, chin down a little bit. Okay, back to the left as far as you can. Chin down a bit. Okay, back to the right as far as you can. Chin down. Back to the left as far as you can. Chin down. Okay, chin up a little. Good, back to neutral. Okay, close your mouth, open, close, open, close, good.
DMX recording. Pause.
I'm also looking at your TMJ while we're at it, so I had you open and close so I can assess the motion of your jaw.
Oh, okay.
Okay, so you are done. Let's come on over here and we can see what this looks like.
Oh boy.
All right, Kaitlyn, I'm going to go through your DMX study here real time. This is one we just took minutes ago. So this is your upper neck. As you bend up and down, I'm looking to see if your atlas is moving excessively. In this case, your atlas doesn't move much at all.
Okay.
So that's your first cervical. It should be moving more. It should be gliding and closing down more on that bone below. And you see it's not. It's almost just frozen in place.
Yeah.
Okay, this one's looking at your entire neck. We're bending this forward and backwards. I'm going to go through and freeze frame this and look at this in detail, but we can go frame by frame.
Oh, wow.
And we can see exactly if at any increment, because this takes 30 frames per second, 4 is starting to slide in front of 5, 3 is starting to slide in front of 4. So there is some excessive movement, which means that there's some damage to some ligaments in the back that are allowing it to slide forward. And again, all of this I'll analyze in detail, and then we'll have a full report on all the findings and all the different ligaments that could be potentially injured.
Yeah.
This is this oblique one, so you're turned this way. So if you look at it, if you're looking from the side, this is angled this way, you look like this, you see right through those holes. And you also see these lines right there, those are the spaces between the facet joints. It's a common area of pain. There's a capsule in between there called the capsular ligament, and with certain traumas, those can tear. And so what happens when you flex the head forward, when you bend forward, they gap too much. It's called facet gapping.
Okay.
When you go back in extension, what happens is they overlap too much, and when they overlap, there's a nerve in there. So that can actually cause what's called impingement, where it pinches the nerve because of the damage to the integrity of the facet joint.
Okay.
And like on an MRI or an X-ray where someone's neutral, they're not moving, they don't ever detect this because you're static, you're holding still. 2, 3, 4, 5. It looks like 5, 6 on this side too. Yep, same thing. So C5, C6 in your neck. When you did that other one, you said it popped. I bet you that was the joint that's moving excessively. It probably popped.
Wow.
Yeah, that's probably the one where you felt it. It was on this view where you said you felt it pop and you bent to the side. Okay, so that much motion where it's gaps apart, that's too much. It should not do that. So that's facet gapping as well. Looks like that's 7, so 6, 7, 5, 6, even 4, 5 to an extent. And again, I'm showing you like a quick read on this right now. Same thing going this way. Anytime you can see all that gap between there, I mean, really 3 of these are very excessively moving. So there's too much movement here. That means, how do you get this area moving better? How do you get this more stable? And then if there's too significant of a ligament injury, then there's things that need to be explored even outside of what we do to create stability. Fortunately, most people are candidates for conservative stuff and don't need to do anything too major, but we can catch it here and see it. And sometimes that explains some sort of issue someone's dealing with that they've not been able to uncover.
Wow.
I mean, this is almost a classic normal as far as going to the right. It lines up. So those 2 bones, when you tip your head to the right, it does not side slip like I'm showing there. It just stays right in line. Okay, that's what it's supposed to do. When you go to the left, it's a different story. So watch what happens when you go to the left. You get your jaw out of the way. You see that?
Wow.
That slippage right there?
Yeah.
Okay. So a lot of asymmetry in how your atlas moves on axis. And even here, it's barely side slipping. That's the border of 2. That's 1. So barely, maybe 1.5 millimeters. And about 2 millimeters or less is still considered fairly normal. This one going this way. You have to get that tooth out of the way. Yeah, that's a big distance right there. So if we throw calipers up here, that's measuring 5.4 millimeters right now. That's a pretty big measurement, especially that asymmetry where we're only seeing on one side. Again, this is just a basic preliminary measurement. We'll blow this up and actually mark it inside of our other software, which is super accurate. But definitely lots of overhang on the left as compared to the right. All right, well, there's lots of information we got just on the preliminary read. We'll go through and study this and put a full report together, and I'll go through that with you once we get that analyzed.
Okay, sounds great. Thank you.
That concludes the DMX study as well as going through the analysis with Kaitlyn. Pretty cool.
Yeah, absolutely.
If you want to see if you're a candidate for this, go ahead, fill out the form on this page and we'll reach out and we will schedule a complimentary consultation with myself or one of our doctors where we can go through your history and see if this makes sense for you. If you want to reach out to us, we have our phone number, our contact information on this page as well. You can reach out before we reach out to you. And again, we'll look for a time where we can get you in as quickly as possible. Thanks for watching. Check out the other videos on this page. We talk further about spinal ligament injury. We talk things about car crashes. There's all kinds of content. So scroll below and dive in. We hope to see you soon.
Video presentation by Meridian Idaho Car Accident Chiropractic. We dedicate our service to Meridian, Idaho, auto accident victims who have been in a car collision and have experienced personal injury. Idaho law allows motor vehicle victims to pursue personal injury claims legally, and if you are not at fault, your chiropractic healthcare is covered 100%. The doctors of chiropractic at Meridian Car Accident Chiropractic in Meridian, Idaho, are specially trained to diagnose and treat hidden injuries following a car collision. If you or a loved one has been injured in any type of motor vehicle crash, we are here to help you get your life back on track. We provide clinical, diagnostic, and treatment excellence. We accept car crash victims, whiplash injury victims, commercial truck accidents, and motorcycle accident victims. There is no fee for you, your loved ones, and your friends to seek chiropractic care at Meridian Idaho Car Accident Chiropractic. Call now 208-581-4353 and let's get you back on your feet.